In this video we will show you how to get rid of tonsillitis. Tonsillitis means inflammation of the tonsils, which are two oval-shaped tissues located at the back of the throat. In addition to swelling, some symptoms of tonsillitis include a sore throat, trouble with swallowing, stiff neck, fever, headache, and yellow or white patches on the tonsils. Bacterial or viral infections often cause tonsillitis. The treatment of tonsillitis depends on the cause and the frequency of the illness. Method 1. Trying home remedies. 1. Get lots of rest at home. People often take 1 to 3 days off of work or school, depending on the severity of their infection. This can be followed by about 1 full restful week, often going to work, but postponing social commitments, chores, and other events until you are feeling better. Speak as softly and as little as possible as you are recovering. 2. Drink liquids and eat soft foods to soothe pain and discomfort. You can create a soothing mixture to help relieve tonsillitis pain. Combine lemon juice, 1 teaspoon, honey, 1 tablespoon, cinnamon, 1 teaspoon, and apple cider vinegar, 1 tablespoon, mixed in hot water and drink as needed. Water also helps to prevent dryness and additional irritation of the tonsils. Hot teas, warm broth, and other warm liquids can be soothing on the throat. In addition to hot drinks, cold ice pops can also soothe throat discomfort. 3. Gargle with warm water and salt. Mix 1 teaspoon, 5 milliliters, of salt into an 8-ounce, 236 milliliters, glass of warm water. Gargle the salt water, spit it out, and repeat as necessary to relieve a sore throat caused by tonsillitis. 4. Remove any environmental irritants. It is important to minimize any irritants that can worsen tonsillitis, such as dry air, cleaning products, or cigarette smoke. Also, try using a cool air humidifier that adds moisture to the room. 5. Try lozenges. Many lozenges contain topical anesthetic within them, which can help to diminish pain in your tonsillar area and throat. 6. Consider alternative remedies. Always consult your doctor prior to trying any of the following alternative remedies, to ensure they are safe for you in consideration of any other medical conditions you may have. They are not recommended for children and adolescents. Options to consider include papain. This is an anti-inflammatory enzyme that may help to reduce inflammation of the tonsils. Serrapeptase. This is another anti-inflammatory enzyme that may help in tonsillitis. Slippery elm in lozenge form. This has been shown to aid in pain relief. Andrographis. This is aimed at treating symptoms of fever and sore throat. Method 2. Getting professional treatment. 1. Confirm your diagnosis by a throat swab and culture. If you believe you have tonsillitis, it is important to see either your family doctor or an emergency doctor, if you cannot get in to see your family doctor on the same day, to get a throat swab to determine the diagnosis. The biggest concern with tonsillitis is when it is caused by group A strep bacteria. This will require medical treatment with antibiotics, as failure to treat it can lead to potentially dangerous complications down the road. 2. Ensure adequate fluid and calorie intake. One of the key things that doctors will want to check in on if you have tonsillitis is whether you are able to consume adequate fluids and food daily. The main thing that would prevent you from achieving these goals is tonsils that are so swollen or painful that it hurts to eat or drink. Doctors recommend controlling your pain via medication so you can continue to eat and drink. In extreme cases of tonsillar swelling, doctors can administer corticosteroid medication that diminishes the swelling. 3. Take pain medications. In almost all cases of tonsillitis, your doctor will recommend acetaminophen, Tylenol, or ibuprofen, Advil, as needed for pain control. 11. Both of these medications are available over the counter at your local pharmacy. Follow the recommended dosing on the bottle. Acetaminophen, Tylenol, tends to be the better choice as it combats fever as well as pain. Most cases of tonsillitis are the result of an infection, so acetaminophen can help to bring your fever down too. However, you must be careful with acetaminophen, as it is added to so many medications, which makes it easy to overdose. Make sure to keep track of the total dosage and avoid taking more than 3 grams per day. Do not drink while taking acetaminophen. 4. Take antibiotics as directed by your doctor. You may be required to take penicillin for 10 days if the doctor determines the bacteria caused tonsillitis. Request an alternative antibiotic if you are allergic to penicillin. Finish the antibiotics even if you feel better. Neglecting the remainder of your treatment may result in tonsillitis symptoms returning or worsening, or you may develop complications down the road if you do not finish your prescribed treatment. Ask your doctor about what to do if you forget or miss a dose of the antibiotic. 5. Get a tonsillectomy. If antibiotics do not help, or if you experience chronic or frequent tonsillitis, then a tonsillectomy may be the last resort. Frequent tonsillitis happens when a person experiences infection multiple times over the course of 1 to 3 years. Thanks for watching. Subscribe our YouTube channel for more videos.